Hi, this is Johannes Huitink. I'm an anaesthesiologist based in the Netherlands, founder of the Airway Management Academy. Today I would like to show you a very nice feature of Airway Triage application. This is an application for airway assessment and risk stratification. When we work at night at the hospital, we know we're tired and we shouldn't make any mistakes. And we've implemented a short checklist you can do before the tracheal intubation of a patient. And today I will show you how the sequence will be done. And we have made a voice-guided checklist, so you know that the patient, medication, airway devices and the team are ready to do the airway procedure. Imagine it's in the middle of the night, we are the anesthetic team. And this patient needs a rapid sequence intubation and we are ready to start. What can we do? We can start using the Airway Triage application checklist, and I will show you how it is done. The patient is still awake, we're going to put you asleep. We will do a very short checklist and help us to prevent any mistakes. First question, are we going to do a tracheal intubation or a laryngeal mask airway? We do a tracheal intubation. Is the intubation needed within 60 seconds? No, we don't have to be very fast, but we will do a rapid sequence induction. So I click yes. And when we are ready, are you ready? The patient is ready. We will start the sequence now. Okay.
1. Oxygen flow FiO2, 100% on.
It's on. Yeah, take a big breath, please.
2. Positioning optimized.
It's okay, check.
3. Suction ready.
Suction ready? Yeah, it's on.
4. Airway devices ready.
Scope tube, yeah, check.
5. Monitoring ready.
Monitor is on.
6. End-tidal CO2 ready.
CO2 monitor. Take a big breath. Yeah.
7.
Yeah.
Vascular access IV working.
Check it, please. Yeah, it's running. Yeah.
8. Supplemental nasal oxygen needed.
Not needed.
9. Induction medication ready.
Yeah, you can take it. Yeah. Ketamine
10.
and rocuronium.
Vasopressors ready.
If we're doing phenylephrine, okay.
Any other concerns? Start procedure.
Are you happy to start?
Yep.
Okay, could you give ketamine, please? Give 70 milligrams. You can give it now. We're going to put you to sleep now. You'll be fine. Ketamine is in?
Yep.
Okay, then you can use the high-dose rocuronium. And if the patient loses consciousness, you can start. Okay, this is the timing. You could give 100 milligrams, so 10 cc. Okay, rocuronium. You can give it now. Thanks. I don't give any back mask ventilation, so I don't expect a really challenging intubation, and we did a very good pre-oxygenation. So we did the checklist. We should be ready. So when the first minute is gone, we can start intubation. For now, we wait 1 minute, and you can see on the screen here that there is a situational awareness timer. So there's the two of us, but the monitor will keep the time, and maybe will warn us if we're too slow. Can you give me the video laryngoscope? And this is a HEINE Blade 3 digital laryngoscope. You can see on the monitor, that's a great view, but I think we would need a bougie. Can you give me the bougie, please? Okay.
Capnogram checked by 2 persons.
We are a little bit slow, but I think the tube goes in. So I think we cannot check the capnogram because the tube is not in, but this looks fine. Okay, can you give me the tracheal tube? Okay, can you put it around the bougie? Monitor is fine, patient is stable. Okay, you can hold it.
Help needed.
No, we don't need help. And I intubate, and now you can take the bougie out and then inflate the cuff. I'll take the scope out, put it on the table. Okay, thank you very much. And then we will check capnogram if we give it this one. This mouth, perfect.
Consider calling for help.
So if we have a problem at this time point, he's asking, consider calling for help. So in this case, I'm not sure if the capnogram is checked. We could call for help, and we could do this from the iPad or from the phone. You can preset the telephone number so you don't lose any time. If the intubation takes really too long,
Help now.
he will consist that you have to call for help, and this is called a situational awareness timer. I've used it many times already for training at the hospitals, the paramedic, the nurse anesthetist, and also the doctors who are going to be anesthetists. They all like it because this is just common sense. We can use a checklist during intubation. It's not rocket science, this is just a checklist. Thank you very much.